Hi, Assalamualaikum. I am teacher Fatiha, and in this presentation, I will share about autism spectrum disorder and Asperger syndrome. So let's get started. So autism spectrum disorder has been defined as neurodevelopmental disorder that is associated with restricted, repetitive patterns of behavior and social deficits, where individuals with ASD may show primary symptoms of atypical sensory sensitivity, repetitive movements, intense interest or fixation, abnormal nonverbal communication, poor social emotional reciprocity, as well as trouble developing and maintaining social relationships. There are several characteristics of autism which can be categorized into: first, deficiency in social interaction; second, deficiency in communication; third, deficiency in behaviors; and lastly, deficiency in sensory and perceptual processing and associated impairments. So I will explain in detail about this characteristic in the next slides. For the first category, deficiency in social interaction. Children with ASD have trouble in developing meaningful relationships with people and even inanimate objects. The specific behavior observed are poor and abnormal eye contact, where they are unable to have eye contact or sustain eye contact. Fail to develop peer relationship is when they have trouble to make friends with children their age. Delayed or inappropriate facial expression is when they have trouble in expressing their emotion. Apparent aversion to physical contact is when they avoid to have any physical contact. Lack of social reciprocity is when they don't know how to positively respond to other people's positive behavior. Delayed or absent anticipatory response to being picked up is when they don't know how to respond when being picked up. Lack of spontaneous seeking of another to share enjoyment is when they don't feel like to share any exciting news with other people. Apparent preference to be alone is where they prefer to be alone. For second category, deficiency in communication, where it can range from mild to severe. Mild referred to as normal language accompanied only by slight articulation or tonal deficits may be observed. Severe referred to as completely lack of speech, or in another word, mute. Children with ASD speech are much repetitive or echolalic. Other type of speech problem are syntax problems, atonal and arithmetic speech, pronoun reversal, and lastly, lack of inflection and emotion during communication. For third category, deficiency in behaviors. Children with ASD can be seen to have intolerance of deviation from routine or resistance to any type of change. They usually display patterns of behavior that are stereotypical, perseverative, or continuation. They also show lack of representational or pretend play. In addition, they also have bizarre attachment to unusual objects such as vacuum cleaner, sheets of paper, sticks, cereal box, battery, as well as fruit and vegetables. Abnormal motor patterns may include wiggling and flicking of the fingers, alternating flexion and extension of the fingers, alternating pronation and supination of the forearm, head rolling and banging, body rocking and swaying, lunging and darting movement, toe walking, involuntary synergy of the head and proximal segments of the limbs, and lastly, inability to perform two motor acts at the same time. The last category, deficiency in sensory and perceptual and associated impairment. Children with ASD have abnormal responses to various visual, vestibular, and auditory stimuli. Children with tactile hypersensitivity are more likely to exhibit inflexible behavior such as stereotypes and repetitive actions. Associated impairments in ASD include intellectual impairment, seizure disorders, and discontinuities in developmental rates. The incidence of seizure disorder in children with autism is high, and both tonic-clonic and complex partial seizure have been reported in this population. The cognitive deficiency of children with ASD affect potential outcomes and may result in long-term disability. Some individuals with high-functioning ASD live and work independently in the community. Some are fairly independent. Others continue to depend on support from family and friends. The prognosis for children with ASD is closely related to communication skills and intelligence. There is a growing intervention for ASD, such as behavioral treatment, psychoeducational approaches, social skills training, communication interventions, speech-language therapy, special education in highly structured environment, sensory integrative therapy, family support, and parental counseling. Now, I will talk about Asperger syndrome. Asperger syndrome is a form of ASD, a neurodevelopmental disorder. However, it can be distinguished from ASD as they do not exhibit clinically significant delay in language skills and cognitive development. There are two characteristics of Asperger syndrome. First, severe and sustained impairments in social interaction. Second, the development of restricted, repetitive patterns of behavior, interests, and activities. Children with Asperger syndrome have significant interference in skills to function in daily living. Although they have language skills that are equivalent to their age, they display unusual habit in verbal communication, which can be characterized by highly circumstantial utterances, failure to convey a clear thoughts, long-winded and unrelated accounts of events, and one-sidedness. In addition, they exhibit lack of non-verbal communication, such as empathy and emotion. The treatment for Asperger syndrome currently consists of supportive and symptomatic intervention. These services include special education program, assistance with generalizing adaptive functioning to a wider variety of settings, social skills training, problem-solving strategy, speech and language skills training, and lastly, vocational training. As with all these interventions, families should be encouraged and supported in making a critical evaluation of the evidence to date before engaging in a particular intervention. That is all from me, and thank you for watching.